Ladies and gentlemen, may I have your attention, please?
Covering both sides of the big issues with the analysis you trust on News Radio 1040 WHO.
We got plenty of stuff that's been happening, though, this week, and the mask mandates have definitely been the topic of conversation in our school systems here in the state of Iowa. Several other schools have either decided one way or another that they are going to require masking at schools. They are not going to require masking at schools. But the main question that I have been hearing from people, the main question that I have had is how many kids or students have actually been infected with COVID-19, and have those infections resulted in any hospitalizations or further complications. Now, with some numbers on this is Dr. Fahmi Farah. She is joining us on the phone line. She's a cardiologist and medical specialist. Dr. Farah, thanks so much for joining us this morning.
Thank you for having me.
Okay, so let's go ahead and just start. What are the infection numbers typically that you're seeing from school-aged children?
It's been a lot higher than what we have, we had seen previously with the other strains before the COVID variant, the Delta variant came. And in the last, during this month, the last few weeks, we have seen more than 243,000 infections among children. So this is quite high, a lot higher than what we had seen in the past.
Okay, so with that being said, a lot of people are going to be questioning where those numbers are coming from. How were these numbers tracked? I know that many people are saying that certain COVID infection numbers might be inflated for one reason or another, or that they're making assumptions on infection rates, even though there's not like a positive test. And of course, there is a sector of kids that are not even eligible to receive any of the vaccines to this point. What are the sources that we're seeing with these infections, and where are they located?
So first of all, the numbers, I think that these you can trust. This is from the American Academy of Pediatrics. That's a very reliable source for the rate of infection that we're seeing in children. And they are monitoring the data just like CDC is, and just like Hopkins also is, Johns Hopkins. So these numbers, I would trust these numbers.
That is important information. So these are not any political organizations. These are legitimate studies, and people are saying that, yes, there is a higher infection rate among children across the country. So the cases we're talking about, nearly 500,000 cases were added in these notes between August 26th and September 9th, and a 240% increase in weekly cases since late July, when they were under 75,000 total cases as well. So it does correlate. I'm not sure we can point specifically as to school getting back underway resulting in a lot of these. But Dr. Farah, is the Delta variant, we did know that COVID-19 has been around for now 18 months or so that we know of, like big and prevalent in our country and in our school systems, and the Delta variant for the last several months. The Delta variant, is it reinfecting children, or is it these children that have not actually dealt with COVID-19 infections before?
That part, I am not too clear on if this is reinfection. I know among adults, people are getting reinfected with COVID. As far as children go, a lot of them, this is new infection. Whether they had been infected with COVID prior, that part is unknown.
We're speaking with medical specialist and cardiologist Dr. Fahmi Farah. Okay, doctor, so how sick are these kids getting? The hospitalization numbers, is that a common thing for the kids? If they do get infected, how severe are those infections?
Overall, the rate of serious illness is far less in children compared to adults when it comes to Delta variant as well, as we had seen previously in other strains. However, I will mention that with the Delta variant, compared to the other strains in the past, children are noticeably sicker. Their rate of getting sick and needing hospitalization is higher compared to the other strains. And we do have children's hospitals are now pretty full across the nation, especially in my area in Texas. The ICUs, the Children's Hospital ICU and beds are almost at full capacity. They have been for the last 3 months since the arrival of Delta variant.
We have also been hearing a lot about RSV as an illness that has been respiratory illness for a lot of children as well. That isn't COVID-19. It isn't the Delta variant, but it also has resulted in several students and school-aged children ending up in the hospitals for various reasons. How much of the hospital capacity would you say is RSV, and how much do you think that it is this increase in the Delta variant for COVID-19?
I would say majority of it is because of COVID-19.
Okay, but there is a significant amount of RSV that has still been prevalent in school-aged kids, correct?
That is correct. Yes, we are seeing more of that.
Okay, so speaking with Dr. Fahmi Farah, I guess the big debate that we've been talking about, a lot of schools here in the state of Iowa, after an overturn by a federal judge about the law that Iowa had passed that schools could no longer mandate mask wearing for students and staff. That was overturned earlier this week, so several school districts already have reinstituted mask mandates. But many people are saying, what is the point of that? Why would you do that? We don't have – a lot of people are pointing that they don't think the science points to masks being that effective, especially if the kids are going to be in close proximity with each other in the schools anyway. But then on top of that, the kids are hanging out, going to sporting events, doing their activities, and not wearing a mask for any of those outside of the 6.5 hours that they're in the schools to begin with. From your vantage point as a doctor, are these mask mandates effective? Would wearing masks for those 6.5 hours, knowing that there's likely no mask wearing for a lot of these kids in their activities after those 6.5 hours, do you think that these mask mandates are going to become effective one way or another?
From a strictly scientific and medical perspective, masks do work. That's just a fact. That's a scientific fact. Masks prevent, droplets from spreading, and that's how the virus spreads. That's how the virus infects people. And so, yes, the way masks work is that everybody needs to wear a mask, and those who are wearing it, they're protected, and those who are not wearing it, it also protects them to some degree. So we've seen it throughout the pandemic. Whenever we were very strict with our masks, everybody was wearing it. We saw the numbers coming down. There's no question that masks work. Additionally, especially when it comes to the Delta variant, it's a highly, highly contagious virus. Masks alone are not enough. We also need to maintain social distancing and avoiding crowd in altogether. And I understand it's a very difficult task to achieve with young children who are going to kids, especially the elementary kids. It's a lot to ask of children to wear masks all day and to get that kind of compliance from them. So it is a very difficult situation all around.
Yeah, and we're going to have to see. Maybe we'll see some numbers changing, but now is a very important moment in the state of Iowa. We're going to have to monitor what the school districts look like and the numbers of children, school-age children 18 and under, specifically 12 and under, that cannot be vaccinated, that could be infected with COVID-19 or hospitalized with COVID-19, and see if those numbers come down to see if that effectiveness is occurring. Dr. Fahmi Farah, she is a cardiologist and a medical specialist. Thank you so much for the time and the information this morning.
Thank you for having me.